Assalamu alaikum wa rahmatullahi wa barakatuh. Very good evening. Welcome to Health Matters. I'm Khawa Solomon and we will be with you right up for another hour or so, inshallah. Please do stay with us as we have an informative show, as in this calendar right now, Congenital Heart Awareness Week is being highlighted. So alhamdulillah, it is something that we don't realize that is happening with our child, but to tell us more in studio and also sharing the platform with me is Dr. Yaqub, our medical specialist co-hosting. Assalamu alaikum to you, Dr. Yaqub. How are you doing?
Wa alaikum salam wa rahmatullah. Alhamdulillah.
Great stuff. And then, of course, our expert on the topic, congenital heart defects, is Dr. Hopeful Nitsinjana. Very good day to you, sir, and thank you so much for joining us.
Thank you for having me.
It's absolute pleasure. I know you're a jet setter, just landed this morning, so I hope you are well and ready for the show.
I'm ready.
Absolutely. So some interesting facts that has came about with regards to congenital heart defect, and apparently not enough is known about it. So just tell us briefly what it is, or better known as CHD, and why the awareness, sir.
So the awareness has been around for a while in the developed countries. But we just got it into our local calendar in South Africa this year, so a couple of weeks ago. And we were all thumbs up and very happy to have this going. Mainly because this is quite an important disease spectrum. And it mainly is a problem that children are born with. And it affects the structure of the heart. And sometimes it can affect the vessels that lead into and outside of the heart. And with the structure of the heart, you can find that sometimes there's a problem with the heart valves that the heart has. Or sometimes the problems are with the connections of the vessels in the heart structure. Or sometimes there may be holes in the heart because the heart starts as a one tube which develops and folds, and sometimes during that building block, if you may, some things don't quite get complete.
Okay. Dr. Yaqub?
Okay, so that's a good explanation in trying to explain the structural defect, Prof. But in terms of the actual diagnosis when it's made, because, you know, the doctors out there generally in primary care and the nurses and health professionals, when they see the children at a certain age as their patients, the minute they hear a murmur, they think a congenital heart disease has been missed. But usually, you know, and obviously you will explain to us, the chance of that being missed at a later stage are minimal because it usually gets picked up earlier. Is that correct?
That is correct. And it's correct in a sense that when the child is presented, you know, the best doctor for any child, first doctor is the parent. So you as a parent need to be very sensitized and aware about your own children. And when you come to us, we take an extensive history to tease out certain things that might enhance the chances of that particular child having a heart disease. But like you said, Dr. Yaqub, not everything that murmurs is a congenital heart defect. And we've got the whole spectrum of what we call innocent heart murmurs. And with that, as the name implies, they really are innocent. But you have to let us as cardiologists be the judge of that. Because many a times, serious heart conditions have been missed and passed on as innocent murmur, with somebody who's just heard the word innocent and think that that's all that is there and there's nothing to worry about. But like you said, with the first presentation at your local family doctor is very important, and giving an extensive history taking is very important. Because for instance, with a mother that has got a serious defect, or a child that has got a serious condition, they will give you a history. Unfortunately, the child can't say, like you and me, that I can't climb. I used to climb 10 stairs. I can't do that anymore. So we have to be advocates for those children. We have to speak for them. And so the mother is the first advocate for that child. And so the mother will tell you, my child sweats a lot when he feeds, which is unusual with the other kids I've seen. So every time I give them a bottle, they get tired. They can't finish their feeds. They sweat profusely and they breathe quite fast. And I can sometimes even hear the heart beating through the chest, beating quite fast, unusual, especially if the mother who's got other children. So this child is out of keeping with the other kids that I've got. So those are all the telltale signs that should raise some alarm bells that there is definitely something going on with this child. And sometimes you find that there's a problem with growth. They don't gain weight properly. And you know that children have to go to clinics to be weighed regularly, and they struggle to gain weight.
Okay, we're going to continue that conversation after the break. We have our expert in studio as well as Dr. Yaqub as we discuss congenital heart defect awareness. Back in a moment.
Life's most persistent, urgent question is, what are you doing for others? A man's true wealth is the good he does in this world. The Mustadafin Foundation feeds 15,000 people a day with your donations to reduce the amount of children who go to bed hungry. How can you help? By sponsoring a pot of food at 2,800 rands or sponsor a parcel at 400 rands. The Mustadafin Foundation. If every man helps his neighbor, then who will need help?
A world of expressionist art and bespoke automotive marks await discerning clients at Dada's Motorland. With a heritage of over 2 decades, backed by attentive and professional staff, clients are assured of an immersive experience at this unique motor dealership. With a dazzling range of vehicles from reliable pickups to the world's most recognizable prestigious motoring brands, Dada's Motorland are ideally positioned to cater to your every whim. Dada's Motorland. Our artistry lies in our attitude and passion.
Wanted to spoil that someone special? Give them a gift from Gifts for You and let them remember you. We stock the largest range of designer fragrances in South Africa and will beat any price. Free delivery anywhere in South Africa.
Shots All Joy brings you the 500-gram big can. Get an extra 100 grams free with every big can purchased. With the Easio top and same great quality, taste and price, you will always be ahead of the class. It's our 25th anniversary Big Can Bonanza. 5 years winner of the International Quality Award. Shots All Joy, class in a can.
Park Avenue Stationers, your office supply specialists. Home to friendly staff and unbeatable prices. We are situated in Fordsburg Garden Route, Plettenberg Bay and Cape Town and offer a next day delivery service. We are stockists of all office and school stationery, art supplies, printers, cartridges and toners, including a wide range of fine writing pens such as Parker and Cross. We provide a wide range of printing, branding, name badges and engraving. We are also proud to boast our in-house rubber stamp department, where we offer rubber stamps while you wait.
Assalamu alaikum, welcome back, a very good evening. And we're speaking about congenital heart defects. And of course, this happens mostly in children. We have a pediatric cardiologist in studio and head of department of the Nelson Mandela Children's Hospital, a professor of his sorts and very busy man, Professor Hopeful Nitinjane, as well, Dr. Yaqub Isak, our medical specialist in studio. So to wrap up what you mentioned earlier of how this needs to be sort of first contact with mom or dad, and we have our sixth sense to know what's happening, and some of the symptoms that you've mentioned, the heart beating very fast, can almost hear it, very thirsty, and your GP being your first port of call as well. So to follow through with that, of course mom's going to panic. What should her first response be? Call the doctor?
So the first response will be to consult your local clinic if you can't get to the doctor fast enough. Especially when you start to see that the child is getting short of breath.
Okay.
And then the doctor obviously is the one who will refer to a specialist, a heart specialist.
Okay.
And the problem, like I mentioned, with our country is there's limited resources. So we have to use every one that we can through this trail of thoughts. Your first nurse that you see at the clinic, if you see the child that you notice something untoward, your child has got blue lips and a blue tongue, you're worried about that this tongue is blue and is out of keeping with the other kids. That's also a telltale sign that the child might have what we call a CHD with a blue baby spectrum, as compared to CHD with a pink baby spectrum.
So we have to still run down that as well.
Exactly. So you have to run down those trails. But I think the first, if you go to the clinic, be persistent as a mother. Because unfortunately, we're not like the first world. Is most of these things are picked up in utero during fetal life, when the baby is still inside the mom. And there's no screening programs available in our country, unfortunately, because of the limited resources. Yes, there are some programs, mainly in the private sector and a few in the state sector, where we can screen fetuses for these congenital heart defects. And even that, we go through the history. The history, as I keep going back, to the most causes will be known based on the background history that the mother gives. If the mother, for instance, is on certain medication, or the mother is taking, especially with the young mothers with acne, they take some acne medication, and that can affect the unborn fetus if they don't know that they are pregnant at the time, or if they are taking some of the mood stabilizers, that can also affect the developing heart in the fetus. And with that background history, then it heightens our senses that we need to look deeper, we need to screen that fetus, and so on and so forth. And
so you're touching a little bit on the causes here, which we also have to unpack. But quickly, before we continue with that, Dr. Yakub, in your sort of surrounding and environment, of course, people come to you for every ailment around the block, and we see this suggestion of Prof saying that, listen, go and see your family doctor first. What is your response to somebody that comes with a baby that has a heart problem and maybe come with those sort of symptoms? What advice and sort of calm the parents down?
Well, firstly, the patient won't know, the mother or the father, or both parents won't know it's a heart problem. So they'll come with a sick child. And then obviously then we'll do the general good comprehensive history and then the examination, and then start excluding what causes maybe in terms of the presenting symptoms. But more specific to what Prof is saying, most of the symptoms that will be related to this will be obviously shortness of breath, and they may be blue immediately, and you spot that. And the minute you spot a child is blue, there's not much you actually need to do, because you already know there's a problem, there's deoxygenation going on, and the child will have to be referred, because it's either a cardiac problem or a respiratory problem. And then the doctor can do a quick examination, because the quicker you get them through, because they may be in a distress situation, they may be in cardiac failure. So the doctor will first assess in terms of the severity of the disease, and then will try and home in, and it'll look at what is the most likelihood of what it is. And if he is absolutely convinced that it's probably a cardiac condition or a respiratory, because they go hand in hand most of the time, then obviously he'll send them to a pediatrician, or if he's got access to a pediatric cardiologist like Prof, he'll be able to do that. In those instances, what we do, we don't even refer back to the clinic, because then we call in the ambulance, or we call in somebody to take them straight through to a specialist center. But here in the metropolitan centers, obviously that's quite easy. But now if you consider in a rural setting, firstly, a lot of the mothers are uneducated, they're a bit illiterate, they don't even know some of the danger signs. So I think if we go back a bit, the education during the antenatal period about danger signs, so you train the mother on the danger signs of her pregnancy itself, and also what to look out for the baby, and obviously the things that Prof mentioned in his introduction, failure to thrive, not eating, unusual behavior. And the more dangerous one again is the mother that has never had a child before, right? And then again, the parental support in our kind of setting, we have lots of grandparents who are actually looking after the child. So, and they have sometimes multiple children that they're looking after. So I think education goes a long way in getting a hit rate, if you want to say, to make the correct diagnosis.
Absolutely. So let's talk about this highlight for this year. It's a big feather in your guys' cap to have this awareness of 2019 on our calendar, CHD, congenital heart disease. What is the plan and the way forward with regards to awareness and speaking out about it at clinics and whether, especially as Doctor said, the rural areas?
So the South African Heart Association, which I am the deputy president of, and the Pediatric Cardiac Society of Southern Africa, which I'm the president of, yes. We've taken it upon ourselves to drive this. And I don't know, it's our first time. And the main reason is to create awareness. Yeah. And by creating awareness, we want to educate the parents, like Dr. Yacoob has said. It's paramount. Grandparents, because they've looked after so many children, if there's something odd with that child, they will tell you that there's something not on. I've had so many grandchildren, something is out of keeping with what I see with this child. And so we want to create, so my colleagues, some of them have already been through the radio station, through the platforms like ITV, like I'm having today, is to create as much awareness as possible. That children are not young adults that are squashed up in body size. They present with unique symptoms, like I've mentioned before. And you need to be on the lookout for those symptoms because, like I said, they can't speak for themselves most of the time. So we're driving this. It will be on our social media pages that we're creating awareness, and we'll also find some parental support groups that will encourage each other so that you can start talking to the other parents who've got similar children who've got the same kind of problems. So this is just to galvanize and make everybody aware. And on the 14th, which is the last day of this awareness, some of the hospitals are planning a little bit of a get-together, wear red in support of the congenital heart disease week. So you are properly dressed actually in advance. You must wear red. If you've got a hat that is shaped like a heart, put it on. And this is like championing all those children that have got a congenital heart disease, because you must understand that this is a lifelong problem. Even after they have been repaired, what we need to educate the parents is this is not a one-stop quick fix. So we follow them lifelong. So they start with us, some of them when they've just been born, but even after they've had their surgery, some of the surgeries are 3 steps, it's 3-stage surgeries. So we do interstage investigation through all that period. So that's why we never kick you out and say, now you've got a scar, that's the only thing that can tell from your heart, but you are totally fixed, you can go home. No, just continue following up. And if you are on medication, continue taking your medication. So that's why we've got this week. And it's going to happen every year so that we can hammer this home and eventually just tap into the government, into our Department of Health that, hey, this is a group, this CHD is the most common congenital defect that you can get in any child.
In birth defects,
yes. Birth defect. So really, if we can't advocate for this, then what
So I believe that half of all of our children are born with this severe congenital heart defect. And, you know, whether they seek help or not, it's a great possibility that they die within the first year.
So, to be exact, 1 in every 100, to put it crudely. Child will be born with some form of a CHD. And sometimes with simple screening post-delivery of a pulse oximetry, which is just putting a little pulse which measures the amount of oxygen in your blood, just on the finger, is non-invasive. You can tell if the child has got a critical CHD or not. And overseas, is part of the national screening program for most countries, and we don't have that up and running yet in our country.
So the pediatricians are not practicing that?
Exactly, not all of them are practicing that. And I'm not sure if it happens in some of the hospitals in the private sector, but definitely in the state we don't have routine pulse oximetry screening.
So in the state, if the babies are born, who is there first? Who are the first
so it depends on whether
medical practitioners?
It depends on whether you're born in the clinic or in the hospital. And the most children will be born, and if it's a normal pregnancy and there's no anticipated issues, those children will be born in the clinics.
So
their first contact is the midwife. or a nurse who's going to look after them. So those are the people who should be aware of these things that we're mentioning today. And then some of them will be born in the hospital, but believe you me, we still miss some of them. And actually, most of the reason why most of our children die from CHD is late presentation. Some of them to an extent that the condition itself has gone on for so long that it would be dangerous to operate on it. Even though, had it been caught earlier on, you might have intervened. So that does happen because as the pressures in the heart change, you get to a critical stage where intervening will be more dangerous than doing nothing.
So if it is picked up, in the fetus, is it possible to be corrected then with the growing baby?
Yes, it is. Yes, it is. And actually, interesting enough, in some countries, like in the US, in some countries in Europe, they've got guys who intervene in utero. To do something while the baby is still inside.
Dr. Yaqub, I think it's very interesting that we as parents must know our and our children's history. And often, as Prof said, it could be your first child. So how relevant is family history to this sort of case and when people are coming to visit you for the first time with an issue? It's
very relevant. Obviously, we're talking about a congenital heart disease. So a proper comprehensive history has to be taken from the mother if she's had other children. But not only that, also a larger and a broader family history is quite relevant. So that would be the history of the family and other children. Then the maternal history itself is very important. Like Prof alluded, sometimes we have lots of young teenage pregnancy in this country, which is still a problem. And with the pressures that the teenagers are on, because they're taking anti-acne treatment, they're taking other medication that they're on. And we haven't even yet touched on other things where there are interactions like HIV drugs, which are impacting. So the history is probably the most critical and most crucial component in terms of getting that information prior to, obviously, even the mother going into her labor. So the antenatal visits, I think sometimes are a bit too quick, too skimmed because of the overload of patients in the clinics, and that in itself is impacting. I mean, the simple thing about the pulse oximeter that Prof is talking about is not even a very expensive item. Yes, but again, obviously health policy and those kind of things, Prof and them will motivate in the various hospitals to bring this through. And this kind of week is excellent because it's like probably going to kickstart some kind of screening procedures, which will only get better as the years go by.
Okay, let's talk about some of the causes and again the awareness on some of the possible drugs or extramural activities that moms are getting up to. Let's help this not happen.
Yes, and so something that we just have to get it out there. And some parents will come to you and say, is it something I did? Is it something my husband or my boyfriend did? So you must know that none of these things are because of somebody having done something wrong. And we cannot predict some of them. And yes, there's some genetic component of the congenital heart defects, and it's very complex how it happens. But it is important to know that if you've got a first-degree family relative, your senses might be heightened that you need to get the child checked out. And if we had we've got a child who've had a congenital heart defect, the likelihood of subsequent children developing the heart defect is also increased. So with all those background history, and if you've got some consanguinity in the family or you're married to a cousin, that also is very important. And there's nothing wrong with that, but you just need to make whoever is seeing you aware of certain things because the risks increase with most things. And if you've had an infection, something common like rubella, which kids get immunized for, and if you are pregnant and you get exposed to somebody who's got rubella, you can end up with a congenital heart defect. You need to mention that, okay, you were very sick at this time and you were diagnosed with something like this, so that we are aware. It sort of just narrows our differential diagnosis to point it towards specific things.
Okay.
Just bringing rubella in the picture again, if you look at the state immunization program,
Exactly.
rubella is not one of the ones on the expanded program. It's measles, but the 3-in-1.
Measles,
it's
mumps,
MMR,
rubella.
yeah, but that's in private. But when you look at the state, again,
Okay.
rubella is not routine. So it has to be mentioned, people have to move it, and it's not that expensive. So again, a lot of this has to do with the education.
You need to educate.
So let's get to some of the symptoms, how it's actually diagnosed. If we could start with our first port of call, Dr. Aku,
Well,
where would you see?
basically, when the child will be born, at the time, it will be given a thorough examination either by the doctor in there or the pediatrician, and then certain symptoms will be picked up. If there is an obvious murmur, the doctor will be aware of the fact that this could be a potential pathological meaning a diseased murmur from a diseased heart and not an innocent thing. And then the broad classification, as Prof has said, is either the baby is blue or pink. If he's blue, then it's more obvious. It is one of those diseases where there's an issue about oxygenation, and the other one is obviously to do with where the baby is still pink, but he's still got some kind of defect. And then they will look at all the other symptoms in terms of the heart rate, they look at the pulse. So the immediate examination, the very first examination, while they're looking for all the other congenital issues like hip dislocation, that the heart is a very critical examination.
Okay, and is that diagnosis made immediately? Any other test?
So, I mean, after going through the thorough examination, which helps to narrow your possibilities to certain group, whether pink or blue. So after that, then once you get to the hands of the cardiologist, then the cardiologist will do an echocardiogram, which is an ultrasound of the heart. It's non-invasive. It's just like you would have an ultrasound when the baby is inside your tummy, but in this time, this ultrasound of the heart itself. So with that, we look through the structure of the heart, and
Tiny
we can
little
tell,
heart.
Tiny little heart. It's about, so often the size of the normal heart of a newborn is about the size of the chicken's heart.
Sure.
So it's just that small. And so we're able to magnify it using ultrasound or
And you guys
echocardiogram.
actually operate on that tiny heart?
Yes, our surgeons do.
Sure.
Our surgeons
Magnifying glasses.
do. Yes. Now, these days, they do wear magnifying glasses,
Amazing.
which they call loops, to be able to magnify the structures they look at. Yeah.
Sure. Okay,
And,
so the echo?
Yes,
Echocardiogram.
echocardiogram,
Okay.
which is the ultrasound of the
Ultrasound,
heart.
okay.
But before we do that, we also start with ECG, which is the electrocardiogram, which just looks at the electricity of the heart, the conduction of the heart, and then we go into an electrocardiogram to get a definitive structural diagnosis of the heart. And then we are able to tell you whether you've got a pink, if you've got a pink type of lesion, we're able to tell you what it is, because it can be one of a few that we diagnose early on. It can be a ventricular septal defect, but by that we just mean that there's a hole between the two pumping chambers of the heart where there's a muscle, ventricular septal defect.
Septum defect, okay.
Exactly. So it's septum which divides the two pumping chambers, and then there's a hole there.
Okay.
And sometimes you can find out that there's a hole in between the non-pumping chambers of the heart, which is the atrial septal defect. Also, those kids will still be pink, but the problem is you get it's like cardiology is like plumbing, really. So what is
like
what the problem is just the shunting of the blood going across through all these holes that you've got in your heart, bypassing where they're supposed to go, and then you will can chamber overloaded. It's like opening the tap and water runs into, and you feel one side than the other, and then you start getting your problems of shortness of breath because you can't deal with the volume that you're overloading that heart with because of all these shortcuts. Okay. So that's the pink bit.
The pink. And we're gonna chat about the blue one when we come back from the break. A very important topic. And the awareness needs to be spread. If you have a nanny, if you have a domestic and you know that they're pregnant and they know their family is pregnant, keep the conversations going, because they might not get all this information. So inshallah, let's spread the love, the information, the Ubuntu within this community as we discuss congenital heart defect just after this.
Participate in high-level plenaries, country roundtable discussions, meetings with financiers and strategic partners, business-to-business matchmaking, and exhibitions at the 9th Annual World Congress for Trade and Investment. Brought to you by the Global Business Roundtable. Entrepreneurs, investors, leaders in government, NGOs, and business people from 80 countries are invited for a week of networking and partnership opportunities. Join us at the Birchwood Hotel and Conference Center in Johannesburg from the 27th to the 29th of March 2019. Tickets now available at 500 rands per day on reglowtickets.com. For more information, call 011-242-8012 or visit gbrcongress.com.
Spice Mecca's newly packaged spices, categorized by spicy orange, exotic red, natural green, and magical purple. Use our blends and seasonings, masalas, herbs, or pure ground and whole spices to create yet another unforgettable taste experience. Choose your color, choose your number. We have your taste. So come on, do it the Spice Mecca way, the cook easy way.
For the past 20 years, Jad Doors has been synonymous with good quality doors because we don't compromise our quality. If you're not stocking the Jad Doors range, call us to discuss real value. We manufacture the widest range, from budget to exclusive, and we distribute to the following countries: Angola, Botswana, Lesotho, Malawi, Mozambique, Namibia, Swaziland, Zambia, and Zimbabwe. Call us on 011 857 2131. Call now.
Imagine the next level in faucet design, coordinated throughout your bathroom. Imagine the redesign of water itself.
Trend, Tap and Tile, Ormonde. Your home, our passion.
Help Heal Syria with the Africa Muslims Agency's mobile clinics. Many of our Syrian brothers and sisters are displaced and in urgent need of medical assistance. The Africa Muslims Agency's mobile clinics provide free medication, professional maternity and pediatric care. Give our Syrian brothers and sisters hope by donating any amount now. Contact AMA on 011 834 8685. Africa Muslims Agency, continuing to empower humanity with dignity, inspiring the spirit of giving.
Assalamu alaikum and welcome back to Health Matters. Congenital heart defects, CHD. CHD is what we need to be talking about now this whole week, and on the 14th of February, it's a big highlight. 14th of February, the Heart Day. Wear red, not just because it's the other thing, but because it's CHD Day. Okay, so highlighting the types of CHD, blue, pink. Dr. Yaqub mentioned the murmurs and the hole in the heart. Are they, and this is my next question, we are going to wrap up with I think the blue, heart, but also what Dr. Yaqub has mentioned, to touch on that, are all murmurs and holes in the hearts CHD defects?
No, they're not, and I think that's the important part. But the thing is, for someone like me at the primary healthcare level, we don't have that expertise to make that distinction. So I think it's important either to send to a pediatric cardiologist or a pediatrician, unless you have a special interest in pediatrics and you've seen lots of babies and have been able to make those diagnoses. But you've got to first exclude the pathology. Lots of them going to be innocent, what we call them, and we see them, lots of children that come in later stages when they're 10, 15, 16, 17 years old. The chances of them being sick are much less because they've been picked up a bit earlier and they've had other symptoms and they've had recurrent illnesses and they've been sick. So that's the thing. But most murmurs, well, they have to be checked.
Okay. We are opening the lines to challenge and question our medical panel here in studio. Professor Hopeful, Head of Cardiology at the Nelson Mandela Children's Hospital, and he's President of the Pediatric Cardiac Society of South Africa. and in association with the South African Heart Foundation as well. So expertise here. Please call the number on the screen if you've got any questions. You've heard of a hole in a heart. I know I have a friend that also said her son was born with a hole in the heart. That was the first time I've ever heard that, and that was a few years ago. So it could be very new to many viewers. So please call the number on the screen with any questions, comments, and also maybe your experience with regards to this as well.
Yep,
so
definitely.
let's jump now to the blue heart. Is that where we jump?
Or the blue baby.
The blue baby, sorry.
Yes, so...
as a symptom as well.
Yes, so this is very, and it's often confused with a respiratory problem like we've mentioned already, because you can confuse it with some form of a lung problem.
Breathing
so that's
stuff.
why it's very important for that child to be checked out by a doctor or a pediatrician to make sure that is it a cardiac or is it a pulmonary problem, and refer accordingly. And so the most common blue baby that we have is called tetralogy of Fallot. I know these words are mouthful, but some of the parents out there might have or known of somebody who's got a tetralogy of Fallot, and which is completely repairable kind of lesion. Yes, it needs long-term follow-up, but nowadays, if caught early, it can be corrected in some form. And the important thing about the blue babies is you get the mixing.
All right, we've got a caller online. Let's take this call. This is ITV Health Matters. Assalamu alaikum. Good evening. Hi. Yes.
Yes. Can I ask the doctor a question?
You may go ahead, Professor, and Dr. Yakub's in studio. You go ahead, sir. Yeah.
Yes, hi. Go ahead.
What's your question, sir?
Okay. Assalamu alaikum.
Wa alaikum salam.
Gee. Well, I was a doctor about the, when children are, when the hereditary problem starts with the cholesterol, at what age should they be screened and for cholesterol level at what age? And the professor asked him is that at what age, if it's positive, like the triglyceride, LDL and so forth, and the total cholesterol is high, at what age should you start treatment?
Professor, do you have any questions for the caller?
No, I got the question. Okay. I got the question.
Shukran so much for your call. All the best, sir. You can listen on screen.
The line is very bad. I can't hear you.
Okay,
what you can do is just listen.
About the hereditary, when you inherit your cholesterol from your parents.
Yes.
Okay. Right. Shukran so much for your...
At what age start the treatment?
Okay, I think...
The build-up of cholesterol.
Shukran so much. We got that question. We appreciate it. Please, if you are calling in, turn down the volume of your television so that we can hear you clearly. And then when you are done with your question, you can hear us clearly as well. If there are any questions, please turn down the volume if you are calling in with your congenital heart effect questions. Professor.
So, thank you very much for the question. This is an interesting, and I think this probably some of the patients that Dr. Yakub will probably see quite a lot, mainly because it's one of those familial type problems with familial hypercholesterolemia. And usually there's no definite age of when, but that is based on the levels that you present with. So it's very important that the caller discuss this with their own lipidologist or the doctor or the cardiologist that looks after their child. Because the planning is based on the levels of, because you've got good fat and bad fat, and you need to measure and see what the differences are like with those. And so those are done one-on-one. And with most of our children, actually, before I plan any treatment program, we sit around the table and discuss the facts and the pros and cons based on the results that we have. It's not like we just pull up a number and say, when you're 10, we'll start doing that. It will depend on what the levels are like.
Yeah, so that is what Prof is talking about, individualized treatment. So it won't be just the cholesterol that Prof will be looking at. He'll be looking at the kidney, he'll be looking at the glucose, and he'll obviously look at the heart, and it'll be a comprehensive assessment, and based on that, he'll get a family history. He'll also see what's happening in the environment of the child in terms of the food and the dietary habits and the exercise. So it'll be a real comprehensive assessment, and then you will guide accordingly, and there'll be a plan of management.
No problem. I hope that answers your question, sir. We've
And
got
just to add on,
yes.
it's what is called a multiple disciplinary approach.
Okay.
So it's not just the
few
doctor.
involved.
You need to involve the dietitian who's going to plan what kind of a diet the child should be on. So that's why you can't just pick up a number and treat the number. You need to treat the individual.
There we go. I hope that answers your question. So we'll take our next caller. This is Health Matters. Assalamu alaikum. Good evening. Hello.
Hello. Assalamu alaikum.
Wa alaikum salam. You may go ahead with your question. We have Professor and Doctor in studio. Go ahead, sir.
Okay, sorry. I'm just watching the show and
yes.
I just have a question for the prof.
Yes. Go ahead.
Sorry. So I got a baby 1 month old. She was born.
Go ahead.
So she's basically had stay in ICU for about 11 days. They initially thought, I'm sure the prof will know more about the condition. They thought it was a persistent fetal circulation. And it's only when I went through the follow-up that they actually discovered that it's what you call co-triatrium dexter.
Yeah. Okay. Yeah.
So it's, I'm sure Prof will be familiar with it. It's sort of a membrane that's growing.
Yeah, no, definitely. Definitely, I
atrium.
know what you're talking about. Yeah.
Okay, so basically, I just like to know, in your opinion, at what stage would you decide to operate in such a procedure? Because I know it entails open heart surgery, but it's a very rare condition of, I think, only an incidence of 0.1%, something like that.
Definitely.
So I just want to like to know, what, in your opinion, what decision would you, or what criteria would you use in deciding whether to leave it and see the child could outgrow the abnormality, or would you opt to sort of operate on it?
Okay, Prof, could you just hold that answer for just a second? Thank you so much for your call. We appreciate you can listen on air. Okay, so we've got a minute to ad break. Do you think we can answer that quickly, or do we need to take an ad break?
Maybe it might be a little bit longer than...
Okay, great stuff. Let's take a quick ad break, and when we come back, more of your questions on congenital heart defects, disease affected by the little ones. So please do call us. We want to hear your story, your questions. We have Professor and Dr. Yaqub in studio with us. More just after this.
Pop, squeeze and enjoy. HQ Foods, the Cape's finest quality sauces made with love. For that perfect match between quality and perfection, call us now on 021 797 0414. HQ Foods, from our kitchen to yours.
For over 78 years, Masons have capitalized on good old-fashioned family values and service. Today they have 3 branches in Benoni, Bethlehem and Balfour. Major appliance suppliers have their own individual showroom to display their own product range. Masons offer the best deals on top brands, from electronics to built-in kitchen appliances and furniture, as well as nationwide delivery to your door.
فكانت البئر عميقة, and the well was deep. Why are we saying كانت and not كانت? Well is feminine, so it should be kana, but because bi'run is feminine.
The purpose of this course and all our other courses that have to do with the Arabic language is we want others to taste the flavor in the Quran Kareem.
Assalamu alaikum, welcome back. A very good evening. Congenital heart defects is our discussion. Remember, 14th of February should mean more than a red heart. It should mean about the little one's hearts that's affected with CHD. And we had a very interesting call. That means you can call in with your questions of the little babies, murmurs, holes in the hearts, any questions, requests, as well as your experience as well with this this condition. We have Professor and Dr. Yaqub in studio with us. But to answer that question before the break, just quickly to recap, what was the question?
I mean, the caller has got a 1-month-old baby who's been diagnosed with what we call chortriatum dexter. And I know these words are mouthful when we mention them. It's one of the rarer conditions. It's quite rare. And so it's classical, the presentation. So these are the kids who would be presenting a neonatologist. They are in neonatal ICU, and you are told that your child has probably got persistent fetal saturation. And what that would cause is increased pulmonary pressures for a longer time than usual with a child who needs ventilation. But as part of a workup for that, most of these children will have an echocardiogram as well. And that's when then you differentiate whether is it a persistent fetal saturation or is it some form of a congenital heart disease. In this case, then, it was a chortriatum, which is some form of a congenital heart disease. And the concern, I could hear it on the caller's voice, that is very concerned with this little one. And my approach is you need a family-centered care approach for such children, because to me, you don't treat the child in isolation when you've got an anxious parent.
1-month-old child.
Exactly, with a 1-month-old. You need to get a team of experts around treating this child, which would involve your social worker service or psychologist to just take care of the parent, because you need everybody to be on board. Way before, because an open heart surgery for a small baby is a big deal. It's a big deal. So you need everybody to be at ease and to trust in the hands of the doctors that are going to be doing the operation. And to me, it's not one man who decides or one woman who decides that this child. So it's usually a team approach. So the cardiologists who have made a diagnosis get good images, discuss this in an open meeting with the surgeons and to weigh up the possibilities, because you have not every child, they might have the same diagnosis, but not every child will present the same. And with, I think the caller was concerned whether the child might outgrow this. And unfortunately, this is one condition you cannot outgrow, because you've got these extra membranes within the non-pumping chamber, which is the atria of the heart. And the problem with that is that they might obstruct the flow of blood while they do that. So the sooner, the better that you get the team to decide what was this plan of management going forward for this child.
In your opinion?
And in my opinion, I would actually go on with an operation on this child after, though, having seen what the images look like, after having looked at it with my group of surgeons and having bounced ideas, so that we can get the best outcome for that particular child.
Sometimes when you delay too long, you cause more complications. So after the optimal information has been made available through the multidisciplinary team, then you've got to make the decision. In this case, it sounds like surgery is the option, and go ahead. Because, you know, as a parent, you would want to delay, but obviously you'll discuss the complications and the risks versus the benefits. And I think that's what it ultimately comes to, that the parents will have to understand what the risk-benefit ratio is.
Very interesting that they involved the psychologist and social worker. So we'll get more on that. Let's take this caller. This is Health Matters. Assalamu alaikum. Good evening. Hello. Yes, do you have a call?
Hello?
Do you have a question? Yes, hello?
Hello?
Yes.
Is it only just about the heart?
We have a cardiac pediatrician.
Can I have something else?
Yes, let's hear, ma'am, what is your question?
I have extracted my teeth.
Oh, unfortunately, we will not be able to help you with that question. We are going to ask the technicians on the other side maybe just to take your question, inshallah, and then we'll try and help you in a future show. Apologies for that. Remember, if you are calling on congenital heart defect, is the discussion, the awareness needs to be made. Remember, the 14th of February, we read for the little ones' hearts. Sorry about interrupting you, Dr. Yaqub. I understand that the sort of team that needs to come together for this specifically very rare condition, but all of the cases are quite unique. I'm sure.
Look, the thing is, the type of pathology we're talking about and the conditions we're talking about today, I mean, firstly, there's a huge amount of emotion involved. You're talking about your children, whether even if it's your first, second, third, fourth child, right? So the parents, and then there'll be differing opinions between the parents themselves, and then there's this whole issue about what happens afterwards. So it's really a long road that most families have to take. But ultimately, most of the time, if they are in good care and a proper approach is taken from the beginning, then the road and the journey is made a bit easier. But from the beginning, it has to be a whole team, and education, again, we are harping on that, is really the key.
So you really need to get everyone on board, because this is, like I mentioned earlier, it's a long-term follow-up for these children. So you really have to get along with the parents as a doctor. They have to get along with you for the benefit of the child, put the child at the center of your care and involved everywhere. So that to me is a very good start going forward. And these things that I mentioned, like your psychologist, you can sense when a family needs support, when they're not coping. Because you must understand that they might neglect other children at home and concentrate on this one. So it's a whole family dynamic that is involved with this child. They are in hospital frequently. They drain their financial resources. So you can't just treat an individual child and forget about the whole family.
Okay, so let's talk about the life of a CHD child and not excluding the family. You've mentioned, you know, have a support. The extended family, of course, knows this little baby is sick, he's ill. Everybody asks you constantly, how's the baby? What you doing? You know, you're bombarded by that. And as your first port of call, going to see your family doctor and then the specialist, this is, emotions are heightened. So for your advice, if the specialists are not sort of, you know, suggesting it, what must you do as a mother? What is the life like for a CHD family?
I always say, I like the mother who asks every question. As a parent, you must be curious and just lay it on the table, because you must know that this is a long-term relationship between doctor-patient relationship.
So there's no cure for CHD?
So there is. So cure is a wrong word to use. So we repair CHD. Some of the lesions are repairable. And some of them, even better when caught quite early, they live a long life and they contribute to the economy and they go back to work. And the only thing that we do, so in the life, and actually when they get to some of them, if they had some form of a severe congenital heart defect. And you have to advise them with things like pregnancy, family planning, and so on and so forth, gauging on what's happening with them. So that's why I'm saying it needs to be a relationship that is based on trust from the start. And there's a stage where they don't want to come in with the parents. Allow them that opportunity to talk to you. You sit with a nurse or social worker and they talk to just you, because they're comfortable when they get to certain stages to talk to just you. And you protect that patient-doctor confidentiality relationship kind of a thing.
The way forward with this Congenital Heart Defect Awareness Week and the highlights of putting the message across, what is your message as we wrap up the show to our viewers at home and the extended people that are not quite able to watch the show or catch the radio interviews?
So my message to them is congenital heart defects are real. They are quite common. And the signs that I've mentioned, be on the lookout for them. And if you've got a child that presents with any of those, please seek medical help. And then you'll be transferred accordingly or referred accordingly once you get to that level. And also, this is our first year, so we want to build more support groups out there, more support groups that will support each family, and will even go bigger next year, so go much broader to reach the unreached, which are more in the rural areas. At least the urban population can have access to most of the things like TV, television, and so on and so forth. You must remember that we get patients as far as from Kuruman. There is no cardiologist there, and they've traveled in 3 taxis to get to you. So we need to educate our medical students. By the time they go and do their rural community service, they must be well educated into how to pick up these conditions. So are the nurses.
Thank you so much, Prof. Dr. Yaqub.
No, I think what Prof has summarized it pretty well in terms of the fact that, look, the awareness is generally, like most things, in the bigger centers and where there's accessibility of information. But with the new technology that is coming. Smartphones are available now, even in the far-flung corners of the world. And I think Prof and his society will have to start looking at some kind of tools to spread that information to where information can be accessible right there in the palm of your hand.
Absolutely. Thank you so much. And of course, you are open to all of those suggested advances to get that message out to potential patients as well and their family. Thank you so much, Professor.
Thank you so much for
having me. It was a pleasure having you in our studio to enlighten us on congenital heart defect. So remember, visit the website, the Pediatric Cardiac Society of South Africa, www.pcssa.org, and just Google congenital heart defect. You'll find loads and loads of information. All murmurs, all hearts, all murmurs and all holes in the heart is not necessary what a CHD, but please go and have it checked out. Listen to the symptoms, hear what's going on with your child, and support the family. From myself, Hawa Solomon, wassalamu alaikum, and goodbye for now.
Spa Serene and Nadia's Thai Massage offers 5-star treatments with the international products used with all our specialized treatments. Be it our Thai massages, foot massages, manicures, pedicures, Regima A facials, cupping, ear candling, or lash lifting. We have on-site security 24 hours. Follow us on Facebook and Instagram or call us on 011 830 1022 or 011 0386 813.
Tantalize your taste buds with a quality South Asian cuisine only from Cape to India. Visit us today at shop number 3, Temple Street, Gatesville, Cape Town, or shop number 1, Gleamore House, 11 Belgravia Estate.
Stashy Distributors, your favorite packaging, baking and storage solution store situated in the heart of Fordsburg, Johannesburg. Visit our concept store and experience our extensive range of exceptional quality products, impeccable customer service and business with integrity policy that is sure to bring you back again and again. We do deliveries. Stashy Distributors, 6 Clare Road, Fordsburg. Call us on 011 492 0033.
واليوم جينا نحتفل معك بالحان بالمركز الأول بأحلى الهدايا أبهرتي العالم وإبداعك يبان يا أحسن قناة بالعرب يا بداية يا أحسن قناة بالعرب يا بداية واليوم جينا نحتفل معك بالحان بالمركز الأول بأحلى الهدايا أبهرتي العالم وإبداعك يبان أحسن قناة بالعرب يا بداية